Now I'm really pleased, like super duper pleased, to move into the beginning of this webinar, the content, which is a conversation with my friend and colleague Ryan Smith. And I want to share, even before I introduce Ryan, just a couple of questions to level set the expectations for the 10 or so minutes we will spend together. We want to talk about what it means to be in the business of innovation, particularly for those of you who are in local government, and what it means to be in that business during this crisis. We want to hear from Ryan about his particular work in the city of Durham. We want to get real and deal with what sometimes feels like competing priorities around public health and economic development within the COVID-19 context. And then we want to put him on the spot and talk a little bit about cooperation. Like, none of this innovation happens by one entity. It's almost always cross-sectoral. And in today's world, it probably requires multiple organizations working together. And sometimes the cross-sector work is easier to do than the work that is cross-jurisdictional. But we're going to talk about how that plays in also. All right, Ryan, so let's start with the first hard question. You're Strategic Initiatives Manager for the City of Durham, and you're Director of the Durham Recovery and Renewal Task Force. Before this, you served as Innovation Team Project Manager for the city. You previously worked for the Duke University Sanford School of Public Policy as their Innovation Director. That's where we first met. And you earned your master's degree in public policy theological studies from Duke University, your bachelor's degree from Sanford. Is there anything else that I should say about you before I launch into my questions?
No, that's wonderful. And let me just say, Anita, it's wonderful to be here with you, and I appreciate the invitation.
All right. So what does it mean when you say you work on innovations in a local government? It was in your title at one point. What is that?
Well, let me say what it's not. It's not about being the smartest person in the room, because I never am. It's not about having all the answers. And in the course, for my team, I work in the Office of Performance and Innovation still. It's not even about that team having all the answers. It is so much about collaboration, which I know is next week's topic. For my specific team, innovation means working in collaboration with those who are the experts. And there are two people that I hold up as experts: those who are kind of in the front lines, who are working and administering programs, and those who are using programs or services or benefiting from them. And our particular work in government is about bringing those individuals together, recognizing their expertise, and having an intentional process of working through solving problems, of improving a model of service delivery, sometimes in creating new programs to better address unmet needs. I think different innovation offices or teams function differently in government. Ours draws a lot on disciplines of human-centered design, of behavioral economics, of data analytics. For those who are not familiar with those, I will just speak maybe briefly to human-centered design to say, at its heart, it is based on an idea that we will have better programs and better policies when we design those with individuals from start to finish who are meant to be the beneficiaries or users of them. And so we try to engage in a meaningful way, both residents and city staff and others, in understanding what a problem is and understanding the barriers, and then working collaboratively to identify solutions that might move the needle forward. And so that's how I would define it. But at its heart, collaboration and working with external stakeholders is critical. I can't think of a single project that I've worked on over the last 3.5 years in local government, and certainly not in COVID-19, that has not required significant collaboration, not only with other departments, but with other governments and kind of private sector collaboration with others. So that's how I would define it.
So I appreciate that very much, because people sometimes think about innovation, and I want to be sure that's not what people are thinking when they look at these case studies, hear from the people who have innovated around these case studies, that sort of it's some sexy product development, right? It's the newest iPhone, although that hasn't been sexy for a while. But here what you're saying is process matters. and who you bring and how you bring them into the process, bring people into the process, and how you help them help you design around their needs, even when they may be inarticulated needs, that's at the genesis of the innovations that you've been engaged in.
Absolutely. You said it well.
So having said that, that's every day. Talk to us a little bit about how the process looks differently when you're innovating through a magnanimous, ginormous crisis.
I really like that question, Anita, and honestly, it's the kind of question that I have been thinking a lot about, especially over the last several months. My work on the task force started in May, and I think one of the things that I've reflected on is, as much as I believe in things like human-centered design and meaningful engagement throughout a problem-solving process, I've reflected on our work as a task force and recognized at times a real tension in responding not only to kind of a crisis situation, but something that is so far-reaching that touches every part of the work that we do. And it makes it very difficult at times to engage in the way that you might in the absence of that. But I do think so ideally, we would spend significant time working, for example, with residents to understand their lived experience, to understand how they're engaging with programs. We have not had that luxury in COVID-19. I don't think anyone has. But so we still try to find ways to incorporate this principle that we need to be building in feedback loops. We need to be understanding what lived experience is on the ground as people struggle with COVID-19. On the task force, we have tried to find meaningful ways to keep open lines of communication and to meaningfully engage different stakeholders throughout the work. We've created nearly 20 different roundtables. Some of them represent specific industry interest. Some of them represent groups of vulnerable populations or immigrant and refugee communities that we are meeting with regularly through the task force, and that we are inviting community leadership on those roundtables to help us understand what questions we need to be asking, to surface good ideas. And certainly some of the work that we've done in Durham has not come from government, but it's come through these community collaborations and by finding virtual ways, which is another thing that makes this work difficult now, of keeping this spirit of engaging individuals who are directly involved and who are struggling the most in being at the table and just figuring out what that means in a virtual environment. So it does look different. I would say sometimes we've had to roll things out that I wish we had been able to spend more time user testing, like more time refining something by having individuals who we intend to use it provide feedback on the early stages. I think what we have had to do is sometimes roll things out very quickly, just given the nature of COVID-19 and what it demands of us, but always keep open and work to continue to reassess and refine. I think part of what innovation is believing that we're never going to get something right the first time, and that's okay. And so how do you build in, even in a crisis like this, opportunities where you can continue to evaluate how well-intentioned efforts and policies, how they're actually playing out, and being open to the fact that some of your well-intentioned ideas are not going to be working out quite the way you want to, and having a system in place where you can be getting that feedback and making changes throughout this process. We've tried to do that in some instances.
So give us a couple of innovations. We've been talking process. Let's talk about outcomes for a minute. A couple of innovations you've worked on that are really focused on the local economy.
Sure. Well, I'll start with our Back on the Bull campaign. It was one of the first signature efforts of the task force. When our stay-at-home orders were first lifted, when actually Governor Cooper put us in the first stage of reopening, we spent some time over that first week going out and just observing how businesses were reopening, what types of how they were communicating to residents, the things they needed to do to stay safe as they were moving through their spaces. We went to our mall and other places, and we observed what I think we would all expect to see. We saw a wide variation in the types of practices in place to reduce the risk of COVID-19 transmission. We made a decision, and under the leadership of our mayor and the chair of our county commission, to really double down and focus on what does it mean to support voluntary compliance. And the Back on the Bull campaign arose out of that as an attempt in Durham to provide better support and to encourage voluntary compliance on the part of Durham establishments to do their part to reduce the risk of COVID-19 transmission. You can go to backonthebull.com to see this. And I would say the heart of this is we have created a health and safety checklist that takes about 15 minutes to get through, where businesses check off the evidence-based things they are doing and committed to do to keep their employees and their customers safe. This is completely voluntary. We did this, again, to support a safe reopening. But one of the things that we have learned in our continued and ongoing engagement with small businesses is that one thing that they need is a way to inspire confidence in customers, that reopening an economy is not enough, that individuals have gotten the message, at least in Durham, that COVID-19 presents serious health risk, and they are very wary of engaging and coming back out in the way they used to. And we see Back on the Bull as one of the answers to that, because what it does is it creates greater transparency. It lifts up the good steps that our businesses are taking to reduce the risk of transmission. We have, businesses can go through the checklist. At the end of it, they print out individual posters that highlight the top 5 things they're doing that they can put on their front door. It maps out all the businesses that are participating on the website, and any resident can go on the website and see everything that that business is committed to do. And we think that that type of transparency, which we didn't have prior to Back on the Bull, is one important ingredient in increasing customer confidence and getting people to come back out and support local businesses by trying to create greater transparency around the steps businesses are taking. One thing I would say about this particular innovation is that, again, it was about collaboration. I didn't have the skills to do this, but one of the things that I'm good at and believe in is finding people who do have those talents. We created we built all of this out for free. We got contributed talents from McKinney, which is a local advertising firm here that did all of the graphic design. And then we worked with some colleagues at Duke University who are behavioral scientists to think through how to develop a tool that would really help businesses plan, that would be easy, that would create greater transparency for customers. So again, collaboration here is at the heart.